The coronavirus is not the only big concern for doctors right now. People just aren't going to the doctor, and that's creating an entire new set of problems, especially for children. Joining us now live is Dr. Jeffrey Loughead, Medical Director of Pediatrics at Northwestern Medicine Central DuPage Hospital. Thank you, Doctor, for joining us. So let's start with fears. Doctor, are patients afraid of even stepping into doctors' offices and hospitals right now, those parents with their children?
Well, we're hearing that certainly some of them are. Some of them have expressed concern that the environment has the virus in it, and that bringing their children to the environment would unnecessarily put them at risk. We think that that's a relatively small number, however, but it is a concerning number that some people are fearful. And we're trying to get the word out that the environments have been thoroughly cleaned. People have really done a great job in terms of social distancing and making sure that patients that present themselves for care can do so safely and effectively. And so we're trying to put that at ease.
Yeah, those safety precautions in place. Another number you're seeing that you're concerned about, a big drop in vaccines specifically for these young children. Yes.
Going with the stay-at-home order in early March or mid-March, and progressively thereafter, the number of children that have presented themselves for vaccination has dropped off dramatically, especially in the very vulnerable age group of less than 24 months. So the CDC recently put out a report and notifying the providers that the number of immunizations that have been ordered by the providers and the number of immunizations reported as being given has dropped off dramatically. And these are going to be very hard for the parents to catch up if they don't do so soon. The immunization schedule for the less than 24-month infant is pretty packed. And so if you wait 4, 5, 6 months, it will be hard to get you back on schedule.
So some parents may be saying, my kids are at home with me, they're not going out, so why even take them out to leave the house for these immunizations? What are you telling parents who say that?
Well, hopefully these stay-at-home orders will start to diminish very soon. And when that happens, the children will come back into the normal routine activities with playing with other children, contact with other adults. And so if you have a partially immunized or unimmunized child, that means that they're going to be at risk for some of the diseases that are still very much prevalent in the community. Things like pertussis are very much prevalent, and we see cases of that every year, and a fairly large number of them. Some of the other diseases are much rarer, but their immunization schedule is done on a very purposeful way in order to make sure that all those immunizations are done in appropriate fashion and that the children are then immunized and immune to those diseases as they approach school age.
All right, Dr. Jeffrey Loughead, thank you so much for joining us, sharing this information.
It's been my pleasure.